Well, after more than a year of discussions and several months of debating, the United States Senate had a historic vote tonight, specifically talking about health care. 4 days before Christmas, just after 1 o'clock in the morning, all 100 senators showed up for the vote, and 60 Democrats voted yes, 40 Republicans voting no. We are talking about the Senate vote on health care bill that's been actually some time now, about several months in the making. There's been a deadline set up for some time to try and get this done before the end of the year, which is why this is happening at this late week and at this late hour. As part of this final health care bill, lots of different things have been included and several things not as well. One of the big things in the United States that people have been focused on for some time is the idea of a government-run public option, an option that would actually be allowed to compete with the private insurance industry. That is not going to happen as part of this Senate bill. There's also been this discussion of expanding Medicare. That's a government-run institution that typically takes care of the elderly or the disabled. That will not be expanded either. And there also will not be any reimportation of medications to try and lower drug costs in this country. The big things that will happen as part of the Senate bill is that there will no longer be any discrimination based on pre-existing conditions, and people will be mandated to buy health care insurance. Overall, it's going to look like a country that has about 94% of its citizens covered, and the hope, at least by people that voted yes on this bill tonight, is that eventually it'll start to lower health care costs overall and try and make the country a healthier place. Much of what I'm talking about now won't be implemented at least until the year 2014, so while the vote is done tonight, there are still many steps before we see any real change. Dr. Sanjay Gupta, CNN, reporting.